member for Innisfail, Sylvan Lake.
Thank you, Mr. Speaker. This government's out-of-touch priorities are no more evident than in our public health care system. For 2.5 years straight, Alberta Health Services has failed to meet their own performance measure targets. On wait times for procedures, the lack of progress would be laughable if it was not so serious. Knee replacements, average wait 41 weeks. In Northern Alberta, average wait time 56 weeks. And yet the AHS target is half of that at 28 weeks. For hips, no better. Target is 22 weeks, but on average we wait 37, longer if you're outside of Calgary and Edmonton. Let's look at access. Most provinces have a benchmark goal of moving 90% of patients through ER and into hospital within 8 hours. In Alberta, our goal is only 75%, and yet we can't manage to reach that goal. In that goal of admitting patients into ER within 8 hours, we only reached it 46% of the time. We don't reward our children for failure. Why are we rewarding Alberta Health Services executives? So knowing all of this, it should be easy for members to understand why Albertans get upset when they hear of Alberta Health Services bonuses, pay raises, and massive increases in spending on administration. Long-term care takes a $52 million cut, but the bureaucratic monster of Alberta Health Services gets a 21% increase.
Shame.
But that's not bad enough. Alberta Health Services then goes even further to tell veterans of the Canadian Forces that their discounted hospital parking passes discontinue. All of this to make room for an extra $84 million in bloated administration spending. And this government has the gall to say they are reining in bureaucracy? AHS centralization was supposed to cut down administration costs and save us money. And yet the bloated bureaucracy continues to grow at the expense of actual health services. Albertans want to know when their priorities will become this government's priorities.
Thank you, honourable member.